My name is Dr. Nishant Yagnick. I am the head of neurosurgery at Manipal Hospital Gurgaon. And today I'd like to talk to you about vascular problems of the brain. When we mean vascular problems, we mean things like brain stroke, we mean things like brain hemorrhage, and all of its causes and how we manage those patients here. So we are a hybrid center when it comes to neurosurgical care in all of Gurgaon. What this means is that we actually have all the different forms of treatments that is required to treat these vascular problems of the brain. Brain stroke, as you must already be knowing, is a very, very common condition. And it can happen to anyone. It can happen to young people, it can happen to older people, it can happen to your friend as your friend is sitting right in front of you having dinner with you. And if the patient is brought in on time, not only do we have the medical management, but we also do the angiographic wire-based management to break clots. We also do open surgery when that is not possible to help the patient fight for their life and their limb. And all of this is done with a rapid management using our stroke unit. See, time is of the essence when it comes to vascular problems. If you wait more than a certain period of time, then the options available to you reduce significantly. And that's why good centers like ours need to be prepared 24/7 for these eventualities. And that's how we have managed our stroke unit. So that is one aspect. Another aspect of a vascular problem is a brain hemorrhage. Brain hemorrhage is like stroke, except here the blood vessel is not blocked, it bursts. And this usually happens because of uncontrolled blood pressure. In these cases, we have medical management. Also, I do keyhole surgeries to make sure that we go in, we remove the clot even from deep places in a fairly successful manner, reducing the pressure and smoothing the recovery and making it much faster. Because a clot left in place starts becoming very toxic to the brain. It causes significant pressure on the brain, significant edema of the brain. It can lead to seizures, coma, long-term ventilatory support. And going in with minimal invasion and just taking out that clot of blood really helps the course of the patients. So when it comes to brain hemorrhage, we have what is available world over, which is both medical management, ICU care, and keyhole surgery to make sure the clot comes out much faster. And finally, coming to the more complex vascular problems. So we are an aneurysm and AVM center. If you tell anyone that Manipal Hospital Gurgaon handles aneurysm and AVMs, it means that we are a class apart from the majority of centers that handle neurosurgical cases. What this means is that sometimes there are anomalies in the blood vessels, which means that they can be, balloon-like dilatations called brain aneurysms, which are very dangerous because they can burst and then burst again within the first few days. There's also abnormal formations of blood vessels among each other, forming a sort of bunch, which is called a arteriovenous malformation. Not only have we operated very successfully aneurysm cases in our center, we have both embolized. Embolization is done through an angiographic procedure and removed these vascular malformations within everyone from children to the adult age group. This is a complex science. It's one of the hardest kinds of surgery that is done among neurosurgical cases. It is, I don't think I know of any center without the necessary facilities who can even attempt these cases. The neurosurgeon there will automatically refuse to see you because they don't have, even if they have the expertise, they don't have the equipment required. And all of this is time-based. Just to make things even harder, if a certain amount of time passes, then the options also become unavailable. So there has to be availability, fast management, time-based management, and the availability of all the different types of treatment that are available. Many patients who come to us have actually gone to a center where one form of treatment is available but the other is not available, and therefore they have to, they've wasted their time going there and then coming to us. So you need the entire range, you need it fast, and you need the expertise to do it. And that is why vascular brain management, stroke, brain hemorrhage, aneurysm, arteriovenous malformation in our hospital has taken a new soar and a new leap to new grounds in the last 1.5 years since Manipal has come over. So please do avail our services and let me know if you have any queries. Thank you.